Good morning, everybody. Thanks for coming to the March quarterly meeting for the Kansas City Healthy Lifestyles Collaborative. I'm Robin Shook. I'm the director of the Kansas City HLC. It's a beautiful day in Kansas City, my favorite time of year. We've got spring weather, Big 12 basketball, start of soccer, start of baseball, lots of fun things going on, and it's spring break. So a lot of people I know are traveling for spring break. So thanks for taking time to be with us here today. Hopefully you enjoy the main talk today that I'll be giving on a project we've been working on for a couple years now. Then we'll also have time to share partner updates towards the end of the meeting. But maybe to get started, since we've kind of got a small group here, maybe we'll just go around and do some quick introductions, and we'll start at the table over here.
I'm Dave Renz. I'm with the Midwest Center for Nonprofit Leadership at KC and partnering with Children's Mercy on this and some other work.
And I'm Cindy Laffer, and what he said.
Yeah. I'm Mary Jason. I work with KC
Chicago, Mountain of Health, Wellness Work.
I'm
for the sports sector, nonprofit, and does primarily training for coaches, athletes, and for users.
Patrick, I'm nutrition and health specialist for the university. I'm Dana Munoz, and I'm with Johnson Recreation.
I'm Laura Bolts. I'm director of education at Bike Walk KC.
I'm the education program manager at Bike Walk KC.
I'm Catherine Murray, and I'm the education outreach coordinator at Bike Walk.
I'm Natalie Updike. I work on the Kansas City Healthy Lifestyles Collaborative team.
I'm Amanda Grimes, and professor at UMKC in our sciences department.
Great. And Katie Amy is around here somewhere. She's helping run the show. She's another member of our team. So you'll probably see Katie throughout this meeting. So to get started, Katie actually has created a nice little icebreaker here. So actually I need to show you this first. So we'll do an online quick poll here to help break the ice. So what you can do is pull out your phone and either scan this QR code and it'll take you to menti.com, or you can go straight to menti.com and put in the access code that you see on the screen. And then once you get there, there should be a little thumbs up icon. You can just go ahead and hit on that, hit that. All right, so in the spirit of spring and spring sports, what is your favorite spring sport to watch? So you can move your little cursor over the point that you want to over the sport that you enjoy for the spring. There's a lot of debate over which sports to include on this screen. Is hockey a winter sport or a spring sport? Excited spring? Okay, has everyone got your vote in? Looks like basketball and baseball are the two top, with a couple tennis. Good. If you could have a workout session with any athlete, who would it be? Katie has chosen Travis Kelce, apparently. runners under in here. Healthy Tiger Woods. Lauren Chamberlain. Should I know who Lauren Chamberlain is? Softball. Okay, good. Brittany Mahomes. Good. That's an interesting one. So gymnasts, couple gymnasts, very impressed. I would not do that myself because I would embarrass myself. And no Kansas City Chiefs, apparently. Cool. Last one. Continuing with the workout theme. You can only listen to one song on repeat for your workouts. What would you pick? Eye of the Tiger looks like the standout winner, which is Katie's song of choice.
No, I was shaking my head.
Oh.
That's hilarious. That was.
So yours, the correct answer is none of them.
These were like top 5 of those songs working out.
All right. Well, that's the beauty. You can pick your own. Oh, okay. Is this the last one, I think? Right. Okay. So which teams will reach the Final Four? Oops. If you would have asked me 2 months ago, I would have thought my Iowa State Cyclones, but they're so injured now. I'm not sure that's going to happen. I don't think I don't think KU is going to. Sorry.
That's a requirement, I have to say.
You have to say
Even
KU.
if-
Yeah. We should clarify this is men's Final Four, not women's. Though there could be some overlap, but. All right, well, I'm pleased several people do have some faith in my Iowa State Cyclones, but my prediction is Houston. That's Houston and Duke are my top 2, I think. Okay, all right. Let's just dive into the main topic. Okay, is the screen sharing still looking good, Natalie? Oh, okay. Let's restart this. Okay, better? Okay. All right, you're unfortunate because you're stuck with me for the main presentation today. And I'm going to share some work that we've been taking part in for probably 2 years now, I would say. And we're very fortunate that we've got our partners from KC, Dave and Cindy, who have really done all of the work on this project. And I think that if they could go back in time 2 years ago when we asked them to do this, they would say, no way. Because this project is mapping the youth physical activities system in the Kansas City region. And I think we were all a little bit surprised at how encompassing and how large this system is. And I believe we originally budgeted maybe a year to do the project, and it took about twice that long because, well, you'll see why as we move through the presentation. So, all right. When we talk about youth physical activity, most of it comes from sports participation, especially as we talk about kids, say, above the age of 5. Free play is still a large part of it, but it starts to go down and sports participation starts to go up. And so, especially when we're talking about older kids, teenagers, we're really talking about sports being the bulk of where kids are getting their physical activity. And this is a nice quote that I have taken from the Aspen Institute. And I think it kind of talks to the power of sports, not only in our case, physical activity, but other things. So sports participation is one of society's best tools for addressing a range of larger challenges, from obesity prevention to cancer risk reduction, to gender equity, to the social inclusion of people with disabilities, racial bias, to the restoration of civic trust across communities. And so that's kind of why we wanted to do a deeper dive into the role and scope of youth sports in Kansas City. And this project that I'll talk to you today is one piece of that approach. It's a pretty big piece of it, but we're also doing some other things, which I'll mention as well. Just wanted to acknowledge Dr. Renz and Cindy. Also want to acknowledge the advisory board for the project. I'll show you them in just a second. The members of the KC HLC team and our funding sources. So we are funded for this project by 2 sources, the Lauren Aronson Frontiers Clinical and Translational Research Program and the Kansas City Royals Foundation. So here is the advisory board that we had for this particular project. And I realize that I think there may be some omissions on this. So if you, as we move with anything in this talk today and you see things that you know are incorrect, please feel free to bring them up during this presentation or grab one of us afterwards. So I took this slide directly from Dr. Renz's kickoff meeting with the advisory board. The purpose of this mapping project was to collect data and create a complete research-based regional ecosystem map that helps us understand the systems of programs and their organizations that are associated with encouraging and enabling children and youth to be physical activity in the 6-county core of the Kansas City metro region. What I'm going to share with you today is very much, I think, what we would consider still in draft form. We're still going through the data. We're still refining our interpretation of the data. And so we very much want your input both today and afterwards. So as a bit of background, we have been looking at youth physical activity in a variety of ways for several years now. This is the 2020 regional report card on physical activity for children and youth for the Kansas City region. So we assigned letter grades for overall physical activity, which you see on the top, and then a variety of other domains and determinants of physical activity to see how our kids in our region are doing. And the answer is most Kansas City youth do not get sufficient levels of physical activity, and we live in environments that do not support physical activity. So the overall grade for physical activity was a C-. And when we talk about some other things like active play, we don't really know. School-based physical activity, we don't really know. For community and built environment, we got a C-. And one in particular that I wanted to call out that we often don't think about is family and peer physical activity support and participation is also something we know very, very little about. But we assume it's probably quite low. And just kind of keep all of these things in mind as we move through the rest of the data I'm going to share to you today. And in particularly, I'm going to come back to this family and peers one a little bit later. You can find this report on our website, physicalactivityplan.org, and you can find it in the Learn More tab. As I mentioned, we really think a lot about sports participation, especially as kids get older, as it's one of the primary determinants of how kids get physical activity. And actually, this was the highest grade that we had in our report card, and that was a B-. And that was because the local data that we had in 2020 indicated that 60% of children aged 15 to 17 played on at least one sports team in the last year. So that's actually pretty good. It earned a B-. However, we know that just that question alone does not give us a full picture of youth sports participation. So we know that there are disparities in youth sports participation by things like income, gender, but as of 2020, we didn't have any local data to support that. Here is just some national data that we included at that time that talked about disparities by income. So for example, in families with incomes of $25,000 to $50,000, participation fell over about a 8-year period from 38% to 36%. Whereas families with incomes above $100,000, not only did they have higher levels of sports participation, it actually rose during that period. So not only did we have disparities, but the disparities were growing. Since that time, we've added some data through a variety of sources. One is the State of Play Kansas City report that was released in September of last year. And that was the result of a year-long partnership between Children's Mercy and the Aspen Institute. We did a variety of data collection techniques during this year, including a youth survey of over 4,000 kids, in-depth interviews with key informants, and we also hosted a State of Play Kansas City Summit just about a year ago. I'm going to show you pieces from that report. If you want the report yourself, you can scan this QR code and it'll take you to it. It's also posted on our website as well. So just some general information about sports. Why kids do sports. It is not winning. It is not to get a scholarship, at least not for most kids. The top 2 reasons why kids play sports is to have fun and to be with their friends. And those by far are the top 2 responses during this youth survey. And the next responses were not even close to these top 2 ones. So improving skills, exercises, winning, those are in the 20%. We're talking about half of the kids that were surveyed play sports because they have fun and they like playing with their friends. However, there are very, very real barriers to participation. Cost and transportation are 2 of the biggest. So I'll just show you just a couple of this data. So at the top, we're looking at travel, team, sports participation broken down by income level. And I was not surprised at all that higher income families are more likely to do travel team sports. Most of us would guess that. What I was surprised at is that, and I wasn't surprised that low-income families were the least likely to do it. I mean, that just makes economic sense. But what I was surprised is that the middle-income people, they also were less likely to participate in travel team sports. And in reality, they were much more like the low-income families than the high-income. So there are clear cost barriers to participating in travel team sports. And other data that we have indicates that both costs and location play a factor. So this is on page 16 and 17 of the report. A couple families said there is a huge need for more courts and fields in Kansas City, Kansas. Homefield had just built their brand new facility over in the Legends. It looks amazing, but the costs are difficult for us, and I don't think it will help people around here. There's another one in Olathe. That's not feasible either. So that gets both the cost and transportation elements. This comment is about that competition sports are all about prestige and they're out of control. So kids are getting burned out because they're playing the same sport all year. I told my coach's son, listen, my son is playing every sport, so we'll be here when we can. And he started to get penalized at age 9. And as he got older, he said, I think he's in a better spot now because he's playing with friends and just playing rec ball. So these kind of touch on, that data kind of touches on a few of the elements that we were interested in learning a little bit more about that we didn't get with the Aspen data. And so about the same time, we were collecting data on this mapping project. And so the rough order of the process was we started meeting with Dr. Renz in 2023. In about a year ago, I think it was 2024, we convened the advisory council to talk about the system. Who do we need to talk to? What sports do we need to think about? Where should we go to find the data? Then Dr. Renz and the rest of his team went out and started identifying and collecting data on organizations and the programs through online searches, word of mouth, snowball sampling. And they spent a lot of time refining the database and then finally released the technical report at the very end of 2024. Like I said, I think we anticipated this process taking about a year. Then about a year in, we said, well, we're still finding programs. 18 months in, we're still finding programs. And it just kept growing and growing. And finally, I think they just stopped because they had to. Because I don't think we will ever exhaust the and get a full complete count. And so I'll get to that in just a second. But if you scan this QR code, that'll take you to a link with this draft technical report that was produced by Dr. Renz and his team. It's 70 pages. And like I said, it's very much a draft. We haven't really been publicly releasing this information yet. Today is the first day that we're sharing any of the data out into the public. And because of that, I will add a disclaimer, and I think I can speak for the UMKC team that this is not intended to be a complete and full picture. We will always be there will always be more programs to find, new organizations to find. And so just keep that in mind if as you are looking through this and you see something, you're like, hey, I know this is missing, or I know that is missing. Please tell us. We will try to update things as we can, but we also acknowledge that this is not a complete picture. However, I think we are very confident in the overall trends and the overall findings that we are going to present here today. So let's start out with the most basic thing. And I suppose the first thing I'll point you to is how many organizations were identified. 541 individual organizations were identified as providing youth physical activity programming. Just as a frame of reference, we did a similar mapping project around childhood obesity programs about a decade ago. And I think we identified 200 programs or organizations, or maybe 100 in some. 108. It was 108, I think. Now, so we've got 5 times that for youth physical activity, which is pretty amazing. Okay, I'm going to show a lot of data, and it's going to be easy to get overwhelmed. So don't try to look at every single number on every single table or every single figure. You can, but you might get a little lost. I'll try to point you to some things that I think are important. And so those are kind of some high level number of organizations, like I said, is 541. And here is how they are broken down into 4 categories. There were 6 collaboratives, 85 governmental organizations, 266 nonprofits, and 177 nonprofits. When we look at it by budget, the largest number is we didn't know what their budget was. It was hard to determine. But of those that we knew, most had budgets of over $2.5 million. So these are not, there are some smaller organizations, obviously, but there are also a lot of very large, what I would consider very large organizations providing these services. Now, these organizations, where do they operate? And again, there's a lot of data here. So let's just look at one piece of data that hopped out to me. The only 10 were operated at the neighborhood level. So out of all of these programs, only 10 operate at the neighborhood level. These are 10 programs, operating at the neighborhood level. Most happened at the city level or the school district level. So a lot of these obviously are going to be your school-based sports programs. Getting back to the neighborhood piece, when we talk about cost and particularly transportation as barriers to participation, neighborhood programming is likely a key part of the solution. So within the Aspen report, there was a section on neighborhoods. And in this on page 12, they talk about within some local neighborhoods, accessing sports can be difficult. Some communities don't have the infrastructure, or children don't feel safe to play in the areas. Additionally, one of the recommendations from the Aspen Institute was that Kansas City needs more bridges between funders and boots on the ground community leaders to address and serve neighborhood needs. Smaller nonprofits would benefit from collaboration. And there was an anecdote about waiting 15 years for soccer improvements. By working more closely with neighborhood and creating neighborhood opportunities with local nonprofits, we think we can address one of the key barriers two key barriers to participation. That's cost and transportation. Okay, so now we'll kind of shift and look at the programming. So of the 500 organizations, there were 3,399 programs that were counted by UMKC. That is an astounding number to me. For, again, going back to our childhood obesity mapping project from 10 years ago, I believe we had 280 programs in that database. So this is almost 3,400 programs. Okay, what are these programs doing? Well, the largest is just kind of general physical activity. So this includes most sports are going to fall under this. Things like even just like a group exercise class will fall under this. So most have something to do with actual physical activity. 28% are actual organized sports leagues. There are active transportation. It shows 0%, but I think there were 13 programs that offered services related to active transportation. How many programs does Bike Walk KC Education have? 5. So Bike Walk KC, you got the director of education for Bike Walk KC here. They do a lot, the bulk of the active transportation, bike education in our region, but it's very, very small, 0.0%. There are very few programs that are specialized for individuals with intellectual disabilities, physical disabilities, or mental health folk. Less than 2% each. When we look at it by what ages are these programs targeting? 10% are for young kids 0 to 4. These are things like I've got 2 kids 0 to 4. A lot of these are going to be like your swim classes or gymnastic classes. My kids have participated in both of those things. Though there are some more sport-based programs as well, like there are soccer programs as young as, I believe, 2 years old. 28% of programs are for kids age 5 to 11, 28, 12 to 14, and 34% age 15 to 18. So the highest number of programs are for the teens, and fairly even distribution between ages 5 and 14. When we add in some other populations beyond just age, there's the data on the just age group. When we add in programs that are accessible to all, about 27% are for kids of all abilities. About 1% are focused on intellectual disabilities, 1% on physical disabilities, 1% on mental health, 2% on family-based programming, and then a small, very small percent on targeting the professionals themselves, like the coaches, referees, things like that. So we'll look at this a little bit more. Here are the total numbers by disability and mental health. So 67 programs for intellectual disabilities, 73 for people with kids with physical disabilities, and 62 for kids with mental health needs. About 2% of the programming. In terms, and just a comment on that, this is one of the key gaps that was identified by the Aspen Institute. So on page 14, they talk about in our youth survey, children with disabilities were more likely than their peers to say they do not play sports due to cost, and finding accessible facilities to play sports can be challenging too. There's a nice example of this group called the Kansas City Kings. how they can't find a place to play. The Kemper is a mecca for youth sports tournaments, as a lot of us know, but we run into problems where we can't in line to book it, and there's only one elevator. So hosting tournaments for kids for adaptive sports at Kemper is not possible, or certainly not very easy. When we talk about where these programs are located, most are at a multi-activity facility where they're doing lots of things, soccer, basketball. And then the second highest number is programs that occur at like a school-based setting. Fair number at parks and playgrounds. When we talk about how these programs receive their funding, 92% receive their funding through participation fees. So basically, almost all programs are going to charge you a fee to participate. I've got a little bit more detail, I think, on the next slide or two, where we'll talk about some other opportunities. But one thing that I think many of us might be surprised to learn is that the city, the federal government, and our two states also are key sources of funding for these programs. I think maybe in the next slide, I think I've got it. If not, I'll come back to it. Here is some more information on where the number of programs and the percent of where they're getting their funding. So over 1,000 of the programs, just about a third of the programs get funding from the federal government. The state of Missouri and Kansas both get, they're higher percentage of funding for Missouri, but there are twice as many programs. So that kind of explains that. So they're really like on a program level, they're both getting about the same amount of funding from the state. And then our city provides, almost 2/3 of our, or about 60% of the funding to the organization. So I got thinking about this a little bit more. And in Kansas, about 10% of public school funding comes from federal sources. In Missouri, about 15% of public school funding comes from federal sources. So these may not be directly going to like a youth physical activity program, but they're going to the school's operating fund. I think, as we've seen in the last 6 weeks, we should not assume going forward that the federal government will be supplying any money to any of these institutions. I think that all of these things are at a very high risk for being things that I never thought would happen. Funding that I never thought would disappear from the federal government is disappearing. So even if like this funding may not be going to support a sports program, if their general operating expenses or funding goes down, they are going to make cuts. And what do you think is going to get cut first? It's going to be physical activity and sports program. I promise you. So if these types of things are important to you, we need to be proactive, and either that's in your professional role or as your just role as a citizen. So I know that I have called my elected representatives multiple times in the past month to tell them to protect the funding that is important to me. So if this funding is important to you, I strongly encourage you to do the same thing. Because we cannot assume that it's going to be here. And I would expect this number will go down over the next 4 years for sure. Okay. Let's look a little bit more into the programs by the type of program. And I want to specifically focus on the elements that we talked about in towards the beginning with families being pressured to be in very competitive sports programs from early on. So how does that play out in this data? Do we have a large number of highly competitive programs, or is it more along the lines of what we would expect in terms of a nice balance between instructional, recreational, competitive programs? So the definitions are towards the bottom here, but overall, and this is broken down by age category as well. So what I was concerned about was that with younger children, we would see a high number of instructional and recreational programs, but as they get older, those opportunities decrease and the competitive and are replaced by competitive opportunities. And that's not really what I think the data is showing us at this point. So, we can kind of ignore the 0 to 4 age group right now, because those aren't really sports at that age. But we see actual increasing numbers of programs by age for both the instructional and recreational categories in this data. Of course, we also see more competitive opportunities for older kids as well, but it is the smallest number of programs for example, the 12 to 14 and the 15 to 18 kids. So I do think that it is a concern for parents that they are being pressured to join competitive programs at a young age when maybe recreational programs are most appropriate for them. But this data seems to tell us that there still are plenty of those recreational programs out there. Now, this is something that, kind of put a pin on this, and we'll come back to it as we talk about next steps in just a few minutes. Staying on the cost theme, as we have seen, most programs charge a fee, and only 5% of programs are offered at no cost to participants. That seems probably pretty low to me, but we need to look into that further. What I do think is probably too low is only 9% of programs offered some sort of scholarship to the kids in their program to offset the costs of that. So again, that's another thing that we'll kind of put a pin on this, and we'll talk about it more to next step. Okay, that's a lot of really technical detail. Let's get to one that I think you probably are all wondering about. What sports are the most commonly offered in Kansas City? So just kind of as a teaser, in our Aspen report, we asked kids this, and we broke the responses down by boys and girls. And 40% of boys said that they play tackle football, followed by basketball at 38% and soccer at 34%. So those were by far the top three. For girls, it was much more evenly distributed. 24% of girls played soccer, 22% played volleyball, 19% played basketball, 18% dance, 17% gymnastics. Then that's what they're actually doing. We also asked them in the Aspen survey what they wanted to try. And we'll just look at boys and girls here. Boys wanted to try tackle football. They also wanted to try archery, weightlifting, basketball, and soccer. Girls wanted to try cheer and volleyball. So maybe just because there's a lot of sports there, it's hard to remember them all. Let's focus on archery and cheer as things kids want to do and sports that kids are doing. We can focus on football, basketball, soccer, and volleyball and dance. So now, what is actually being offered in Kansas City? Here are the top 26 programs. And this is all genders. Soccer was number one, 268 programs. Swimming was second with 247. Dance was third. Basketball, baseball, volleyball, gymnastics, tennis, golf, and football tackle were in the top 10. So boys said that they played in the Aspen survey that they played tackle football the most. But in this data, it was only the 10th most offered sport. The other ones I think are mostly about where I would expect them to be. Swimming is one of those where there's a lot of programs. It was not particularly high on the list for what kids did or wanted to do in the Aspen survey, which is kind of interesting. The number 2 wanted program for boys was archery. Fewer than 10 programs in the region offer archery. So, just one comment, there are a lot of programs that were labeled general physical activity. So as we looked at those can include things like a sports camp that is being offered, a group exercise that might be offered, things like there. I saw a couple boating and canoeing. Obviously, there's 650 of them, so there's a long list, but you get the idea of what would fall under general physical activity. Here is just another way of looking at this data organized by age. Let's see, what did some things jump out here? So soccer, again, was by far the most common, and it was really the most common at basically every age, except for the young kids, where swimming was more common, and actually in the later ages. Oh, and I guess if I look here in 12 to 14, lots of swimming program here. So swimming there's a lot of programs. Does it match the demand? Yes, if they exist, maybe it does, but not what we've seen from some of our earlier surveys. I guess maybe the only thing that I'll look at here is getting back to this family piece. There really were very few family programs except for things like swimming. I take my 11-month-old baby to swimming lessons. I'm in the pool with her, obviously, so that is a family program. I think you probably see the same thing with dance, where you see large number of programs where parents are encouraged to participate with their children. The other one, and Dr. Grimes just left, I know she does yoga with her 7-month. So that is another family-based program. So most of the family-based programs are not ones that are particularly common. We're not seeing a lot of family-based soccer programs, not seeing a lot of family-based basketball programs. They tend to be things like swimming, dance, and yoga. All right, the last thing that I want to share with you gets at the system perspective of this data. And when I talk about system, this is kind of what I'm talking about. All of us reside in our own little system that resides within a system that we share with other people. And that system determines our behaviors to a large part. So things that we think about, and there are a variety of things. So there are interpersonal things, I'm a white male, I've got 2 young kids, very much hindering my ability to be active. There is your environment that you live in, or your perceived environment. There is your ability to do things like recreation and active transportation. There are other settings related to your neighborhood, your home, your workplace, And then there's the policy that we live in. Does our workplace have supportive policies for physical activity? Does our government, our Parks and Rec departments, is that supportive of, do they have policies that are supportive of physical activity? And so if you think about this kid right here, you know, this say 6-year-old kid, and how accessible his environment, he's able-bodied, he can access basically everything within his environment without any problem. Does he a lot of recreational programs? If he's from an upper middle class family, he probably has a lot of opportunities to be active. Cost is not a barrier to him if his family makes more than $100,000. And depending on where he's at, he might have a lot of opportunities to participate in public recreation. But if we think about another kid, we know there are sex-based disparities and race-based disparities in some of this data. How does a girl who's the same age, who is African American and maybe lower income, how do these same factors influence her ability to be physically active? And likewise, a kid who is disabled, how do these factors influence his opportunity to be physically active? If we look at the data, this kid is more likely to meet the federal recommendations for physical activity than this girl. And both of them are more likely to meet the recommendations than this boy. And that is due to a lot of factors that reside into this. So we have attempted to analyze that in this data as well. So here is just another way of looking at that data that I showed. There's your individual level, there's your interpersonal relationships, there's your organizational community environments, and your public policy. And these are important because they can influence behavior, and certain levels of influence have more impact on a population than others. So for example, if there are a lot of programs that are targeting individual level knowledge, attitudes, and skills, it may have high impact on a given individual, but it will probably have low population level impact. These things can be very costly to deliver in a one-on-one setting. That's why they often do not have a very large reach. However, there are things like public policy that have high population level impact. So I say all the time, Title IX is a federal policy requiring equal representation or equal support by sex in our education or in any setting that receives federal funding, including our educational settings. So that's why there have to be equal opportunities for sports for girls as there are boys. It is the single best physical activity intervention that has ever happened is Title IX. It created incredible opportunities to create increased participation by girls. So let's try to look at that using this data. So here is just those domains organized into three more easily defined or easily organized areas. Formal structures refer to things at the top of the system. Social and physical environment deal with things like on your neighborhood level, maybe touching in your workplace, your school, maybe touching into some of your family, but that mostly occurs, the family and individual behaviors occur in this transmission of behaviors and practices. Now, as I think about this system, I would expect the number of programs to be largest down here, just because you require more of them to target individuals and fewer up here. You can have a smaller number of formal structures, but they have a big impact. So that's okay. But you do want some reasonable distribution of programs across all of these levels in, a healthy system. In our case, 1,000 programs, we're dealing with formal structures. About 4,600, we're dealing with your environment, and about 6,000, we're dealing with individual transmission, individual behaviors. Now you're going to say, you know, that this is, you add these all up, they are way more than 3,300. So things can happen in multiple levels, which is why you're seeing higher numbers. That these don't add up to 3,300. But hopefully you get the idea of the distribution of where the work is happening. And when we map it out in a bar graph form, you see not only this unequal distribution across these different categories, but you see that the orange and the blue dominate the programming. Orange is direct services and blue is consumer education. So they dominate every single level of this system. And they also, for example, direct services are least likely to have a big impact in this formal structure area. Where we want to see things are law and policy, systems monitoring, advocacy and mobilization. And you can see the numbers here. We're talking, you know, about 50 programs out of all of them that actually target these things in formal structures. Which means that we, in my view, our system is not appropriately balanced. And as you talk with individuals who operate in youth physical activity, they will tell you that it is the wild, wild west. Each program fighting for their own existence. There is very little coordination, very little advocacy for community-based things. And when that happens, you see people getting left behind because populations are that face barriers are not having those barriers addressed because there is no one advocating for their needs within this system. And as they talk about on page 43 of the, this is in the actual report now, only 2.4% of all programs engage in the work of systems organization. And there is no single program or entity that serves as a metro-wide coordinator and integrator for the Kansas City region. For systems monitoring, there are only 49 programs, or 1.4%, that operate in things like monitoring the performance, developing accountability benchmarks and standards for children and youth within this system. So as a result, no one really is considering these aspects of youth sports. That is leaving kids left behind. Okay, that's a lot. I'm almost done, I promise. What are our next steps? We have put all of this data into an online repository called kcsportsdirectory.org. I'm going to pull it up and show it, walk you guys through it in just a second. So I'll come back to that. Second, we are, even though this is a mapping project, this is not a geographic map. We didn't geographically map any of these programs or anything like that. So we're working on that in the next few months. We are also starting phase 2 of this mapping project. There were a lot of gaps that were not able to be answered in this data collection. So we are going to ask more detailed questions about youth physical activity programs for 5 areas. 4 sports and 1 general category. So adaptive sports, and then we're going to look specifically at tackle football, flag football, dance, and soccer. And we are going to talk to about 15 providers within each of those areas and get more information on the breadth, depth, and scope of participation. Who is participating, who is left out, what are the program costs, what are the barriers, etc. So that is happening now, and maybe I'll give Dr. Renz a chance to talk about that in just a second. And then last thing I'll mention is we'll continue to implement the strategies that we have outlined in the Kansas City Physical Activity Plan and the Aspen Institute. I showed you some of those throughout this presentation. Before I let Dr. Renz say maybe just a couple closing comments on this, I wanted to show you the sports director. So this website houses all the data that I just showed you. It is designed to be a resource primarily for parents and caregivers to find opportunities for their children to participate in sports. This is very much a baby. This website is very much an infant. It was, we haven't shared it with anyone. We are still working on a lot of aspects to it, including things like the fonts and logos and things like that. But just to give you a sense of how it works, you can search for a specific organization or a specific address here, and it will pull up all of the opportunities that exist. For example, I just put in, oops, that's not a zip code, for a particular zip. And so here are all the different opportunities in the 64131 zip code. And let's just see, let's just click on one. Center School District 58. If you click on this, it tells you this, they offer a fall boys soccer program for ages 15 to 18. It is for boys. It is both instructional, recreational, and competitive, and all races are encouraged to participate. It also gives them other information. There is a fee to participate. It's intramural, interscholastic, things like that. You can also search, like, let's just say you want to only look at, let's just pick basketball programs within that same zip code. Oops. One program came up, according to this. Center School District again. And it is their winter basketball program. They offer, this is for teens, boys, and girls. So all the programs are in there. Obviously there's things like this basketball program has a picture of a soccer ball. We're going to fix this, right? But you get the idea of how this can be used. So you're welcome to begin using it. You can share it with people. We're not going to do a lot of promotion of this until we get some of the details fixed. But if you want to begin using it now, your organization, you're more than welcome to. Just know that we'll begin formal rolling out later in the year. So with that, I'm going to stop talking and I'll give opportunities for questions. Maybe before I'll do that, does any members of UMKC want to share any of their thoughts?
Well,
and you're welcome to come up here.
No, I don't need to come up there, I don't think. As Robin just mentioned, we are just transitioning into the phase 2 part of our project. It's certainly not phase 2 for the larger Kansas City Physical Activity Initiative overall. So we will be trying to better understand the first. One of the ways I try to help people understand that database is that it's like a census. Some people say, well, is there duplication? Is there overlap? Are they all good programs? We make no pretense of judging those things. We're just trying to figure out who's out there. You know, subsequently, there may be other evaluative processes, other things like that. The census tells us the kinds of numbers, and I thought Robin did a very nice job of highlighting some of dozens and dozens and dozens of tables. It's the report plus the list of the organizations in it. It's, you know, the reason for lots of, you know, there are 3,400 programs, 3,300 of them are direct service. The ones that are not direct service are entities like Children's Mercy, the Kansas City Plant, things like that. You know, not providing direct service to children or families, the sense that you can go, you'll be able to play better basketball after, well, maybe you will after hanging out with Robin, but that's not what the program's about. There. Phase two is I think Robin nicely explained, is getting more into trying to understand. Again, we're not interviewing, we'll rely on the Aspen Institute insights from their survey of kids. And so that's just to complement that and the census, looking at what program providers and particularly coordinators of multiple programs. So I will be pestering some of you, and I've already pestered some of you, to sit down and talk with us. We're looking at both archive secondary data, a jargony term for other studies that have been done that will perhaps at the, for example, an individual parks and rec district or something like that. We're trying to figure out, has data about participation barriers, things like that, so we can put that together. We will also be interviewing with a sample of the more active programs in the core sports and the adaptive categories, just to try to learn more about trends that the providers of the programs are seeing in terms of who's participating, who's not. Are there, what happens over time? You know, one of it's not just are you in or are you out, but you know, maybe you come in and you're involved, but people drop out. So what are they observing? What are the program providers observing? What are they hearing from parents and kids? What are they hearing from their colleagues in the field? So this is a lot of interview data, interview work, as opposed to the census, which is very much, a lot of it was on website searches, things like that. I would highlight one thing, and as Robin has said, the census has only a slight form of geographic data, little things that are there. We have the actual location of the program host. You know, I mean, if you're in Center School District, providing services to more than one zip code, all we have in zip code, that part of geographic is that, you know, where's the headquarters based in, so that's an issue. We do ask programs, and I have moderate confidence in the reliability of this. What's the scale of the work? Now, you know, I mean, obviously, if you're a school district, you know, the geographic scale of your work is the school district boundaries. If you're, you know, the Jackson County Parks and Rec, the geographic scale of your service provision is Jackson County. So that's easy. But a huge number of these programs, particularly when you get into like traveling teams and things like that, well, who is actually participating? And one of the things we hear in a lot of these mapping projects when we talk to people is say, well, what areas of the metropolitan region are you serving? They'll say, well, it's the whole metropolitan region. It's kind of like if you're in Raymore, somebody can make it from Olathe to Raymore, then fine, you know, won't send you away. But you know, that's not really true participation open to everybody. And so our interviewing will try to bring more nuance, sophistication to our understanding of what's happening. We can't do it with all of the sports that we see here. So we're focusing on these 4 specific sports and then the adaptive sports category. And many of you will be already have been pinged by us to say, hey, can we talk to you about what data you have, what's your system using, things like that. If I understood correctly, yeah, I'm sorry, I'm pointing at you, Rosanna. I will be calling you because I want to find out for your Parks and Rec system, who I should talk to, maybe it's you, about what data does the system collect? And what you know from that data about participation, maybe by age, by others, there's things like that. So now, I guess I shouldn't have told you because you may never take a call or an email from me again, but that's the kind of thing we'll be doing. But happy to answer questions now or later. And I do want to underscore something Robin said, which is, you know, this is really a sports directory, which I love design of when it goes live. What we're going to find out is a whole lot of people will say, well, the entry is not correct about us, or why aren't we there? Now, by the way, sometimes there's a reason why they're not there, which is if you're a multi-purpose program that doesn't focus on serving children and youth, you're not listed in the database because the database focuses on those programs that exist to serve children and youth. But no doubt, holes and other mess there, and we're going to work to clean it up. It's a developmental process.
Thank you so much. So questions, comments, criticisms go to Dave. But
Yeah.
let's see, there's a question online. So Autumn, you can unmute yourself if you'd like and ask your question.
Hi, everyone. So I work for UMKC Campus Recreation, and I oversee Sweeney Center as well as Durwood Stadium. So great work. I am just wondering if sport facilities or recreation facilities will eventually be identified and added to the KC Sports Directory.
Great question. Where they exist to serve children or youth. Turns out I'm actually in the camera shot there. When they exist to serve children and youth, children or youth, or families for that matter, then the idea is that they'll be in there, and some facilities are in there. I will admit that, you know, even though I can look out my office window and see the UMKC facilities, they're not listed in here because they are, at least by our interpretation, you can correct us as everybody should, wrong. Our assessment was that those facilities were not there for children or youth. They were there for college kids and to a degree adult. I may be incorrect about that, and again, that's why we're happy to hear other things. We have some facilities in there, some of them are missing, and I mean, as I said, some of them, because they're not focused specifically on children and youth, they're just, you know, an arena. They're not listed in there. Maybe down the road we should add those kind of facilities, but it's you know, like home field is in there. The Advent Center at Blue Hawk is in there because so much activities for children and youth. But it's I guess the research term would be spot.
Does that answer your question, Autumn?
Yes, it does. Thank you.
Yeah.
I want to make, I guess, a comment of information, some of the data that was like at the very end of the presentation. I was involved in like Olympic volleyball, so club volleyball and that in like junior high, high school and all that. Really having a lot of experience, the middle income folks, and my parents lived in Cass County. And in order to be a part of like a club volleyball team, we were traveling all over. Just did happen to practice out of like KTK, out of the community college, things like that. But a lot of the issues I think that you're hearing even today is what my mom probably would have echoed. You know, I mean, we had transportation to get there, but the time it took to get there, and the cost to be in a club, really prohibited me from doing much else, and became one of those. As I know your kids surveyed said they were doing it for fun and to be with their friends. Surveying my mom would have been like, she's not fit for college. So But yeah, just, and also knowing the state of like organized sport right now, knowing that like the earlier you can get in, better chance they have like through that or the elementary and middle school, definitely into high school level. But that also being a barrier too. So, like I said, comment of affirmation. So
And if you're interested in learning more about the cost piece, the Aspen Institute just released, I believe, last week or 2 weeks ago, their annual sports participation cost report, and it has, I believe, costs have doubled in the past 8 years to participate in sports. And their numbers, can't remember exactly what it was, but something like $1,800 was the average that families are paying. And most people, when they say that, saying that is low by 3 times. So it's a huge barrier, and we care about it because it leaves people behind, and it creates opportunities that may not result in lifelong participation in these activities. Any other questions or comments? Pete, I know you have a comment.
And when I was looking at that data yesterday, I think they broke down that Aspen Institute data based on income level. I want to say it was like $2,500 average if you were over $1,000, but $800 average under $50,000. So it's the gap is, and the report does stuff in this area. The gap is widening. You referenced that earlier from the Kansas
Yeah.
report. The gap is wider in terms of who can participate.
Okay, final thoughts? Okay. Moving on to the rest of our program. Thanks for listening to that data. Like I said, it was brand new, so we were excited to share it, and you'll probably learn more about us. Okay. All right. Now we're going to move on to updates. So we'll start out with some updates from our team first, and then we'll give everyone opportunities to share updates from your organization. What you see on the screen here are the upcoming Kansas City Physical Activity Plan sector meetings. Most of the sectors are meeting in the next month. Some are taking a month off or so to for spring break or some other planning. But if you're interested in attending any one of these meetings, the best way to do so is to go to our website, and you can see, I'm forgetting what the tab is at the top. Join us, and then upcoming meetings, and then that'll pull up this calendar with the registration information. Okay, we will highlight just a couple sectors who might have some updates. So early childhood.
Yeah, meeting next Monday, and Dr. Brock, who presented at our December quarterly meeting, has a new study that I think she's going to share some information about. And I think they're starting enrollment for that study. So it might be an opportunity for some of the early care providers to join that study. And I think she's also going to share some data from her active living conference presentation during that meeting too.
Great. Thank you. Healthcare.
We don't actually have any updates.
Oh,
It's just
okay.
that we have multiple smaller groups. So like we have a curriculum group. So just highlighting if you'd like to join us. We meet again April 1st. And then we have a Just Walk. Have different Just Walk locations through Children's Mercy, one on Del Hall, one in Crown Center. We actually have two walks coming up, one on the 26th and 27th. So if you'd like any information on those, let me know. And then just our regular sector group.
Great. Thanks, Katie. Faith-based settings, we are, this is one of the sectors that not currently meeting, so if you're interested or have a good recommendation for who might be a good sector lead or organization to lead that sector, please let us know. Okay, now we turn it over for partner updates. So here's your opportunity for any of you to share some upcoming events that you would like others to hear about. So anything going on? I know there's lots going on.
I'll just say, at Bike Walk KC, we are doing a lot, of applications for funding, to be able to reach more families. So our typical model for delivering our programming and primarily the youth programming, is kind of like a one and done type thing. So we've worked with same schools multiple times, but we're looking at maybe delivering programs more within an entire school year. So working kind of longer with one partner rather than just coming in and being a module that happens like during PE. But the intent here is to collect more data from the parents around modes of transportation, encouraging active transportation behaviors, doing built environment assessments around schools to understand what the infrastructure issues are, but then creating a lot of engagement and meeting opportunities with the parents through things like a walking school bus or other kind of bicycle education programs that would happen throughout the year. Again, just to help kind of flesh out and fill more in on the data side of why maybe families aren't participating or what we could be doing to help them make that a first choice rather than last resort.
So contact you for more information?
Sure. Or give us money to do it.
Or yes, she's passing around the basket. Yeah, great.
We do have a community dashboard that talks a lot about our education programs and who we're serving. It's on bikewalkkc.org. You can type in community dashboard for that and find some of that information, but hopefully this new delivery way of delivering our programs will help give even a bigger picture around the communities that we serve and inclusion of the parents' information with that too.
Great, thanks.
I'll throw in a word for the sports sector. We've started in the last couple of months doing kind of just informal meetups, coffee meetups. Only the next is quite scheduled yet, but I'm sure it'll be put out in the emails and such as those come out.
It'll be Thursday, the 7th at across.
Perfect. So it's scheduled between yesterday and today. Great. I think Bill's hosting that, right? Bill's out there online. Bill Brandmeier, our co-lead. But that's been a great opportunity, I think, of people to get together, and I would just extend that to anybody who's interested in kind of an informal thing to have a coffee or whatever and talk about ways to collaborate. So that we've been really focused on lately. How do we collaborate across sectors and with anything that's involved as well? Hopefully, it's a good idea, even off the wall, like that we haven't thought about through this sort of informal meeting. Join us.
Yeah, and it's great to, as witness here, it's great to be with people in the same place rather than just online all the time. Any other programs?
We, to kind of what Laura was talking about, we have some public facing events that are coming up where we can distribute bicycle safety lessons and materials to community members. We're also participating in the corporate challenge again this year. We do kind of like a little bike rodeo with folks from Children's Mercy. And that is on Friday, April 11th at the Truman Sports Complex. We're going to be set up there. We're going to kind of do like a little bike safety demonstration, little skills course, and folks can also get like a little goodie bag with helmets, lights, safety materials, that kind of thing. So we're super excited to do that. We've done that for several years. We have several events coming up on weekends. Most of them are in north of the river, one's in Gladstone and one's in Liberty. You can get more information on our events page. We're plugging those in probably this week sometime. So again, you guys can distribute those. We're going to be giving away helmets, lights for free to folks. I know a lot of the times folks, you know, barely have enough money to get bikes for their kids, let alone the safety equipment that comes along with that. We actually just hosted a volunteer event last night where we had volunteers bag up the lights, get little tags, everything's ready to go. So we're ready to get those out of our doors. So those coming up soon.
I'd like to say we've never volunteered for Operation Blinky Light. I know, I wish I could have made it yesterday. It's a lot of fun. Like, if there's another one coming up, I do.
It's usually about once a year. Maybe we have another
It's a
one
good
coming
time.
up.
I'll tack onto that too, because the Family Fun Zone, our business and industry sector is doing a sports equipment donation that day. So for Cornerstones of Care, we're collecting basically all like sports balls, basketball, soccer balls, footballs, kickballs, and then gloves and some bats. For the YMCA and their Learn to Swim program, which is a free swimming program, swimsuits for school age like 6 to 12. New and gently used martial arts keys, if anyone has those laying around. And then for the early childhood group, some early childhood sized kickballs, basketballs, soccer balls, and hoops. So you can drop them off at that event.
It's great. Is that list gonna be provided somewhere?
I can send a flyer out.
Okay, yeah, we've got a flyer for it, and just to be clear, they can be, they're not new, it's gently used, right? Is that what, or what's your?
As like close to new as possible. If there's
Okay.
a lot of damage or wear, we're not gonna give those away.
Yeah. Great. Excellent. Yeah, that's the second year we've done that, and it just keeps growing and growing, and hopefully it turns into something even bigger in the years to come.
I was gonna say the fantastic fun zone because I'm helping coordinate, so
Yeah.
I'm so excited for the bike walk. Yeah, it's April 11th, as Nolan was saying. If you have kids or you wanna attend, please feel free. We have, I think, 28 different vendors coming this year. So it's sure to be a great time, and we have activities for the kids. As Nolan said, bike walk's going to be doing a bike, not rodeo setup, but yeah. And then we'll also have some other activities like a large coloring library is gonna be set up, but we also have like physical activity opportunities such as we're trying to do archery. I know we've got like a disc golf set up, that'll be there. Just a lot of fun stuff. So please, if you're free, come out and attend.
Yeah, so that's at the Corporate Challenge kickoff on Friday, April 11th at, what was the time again?
Need to be set up by 3:30. No, it's like 3.
Yeah.
I'm there all day, so I
Four.
don't know exactly.
4 to 7:30.
Yeah.
Full event.
Yeah, thank you,
Yeah.
4 to 7:30, so a lot of people, if you're involved in Corporate Challenge, a lot of organizations come out and they do the walk around the parking lot. There's also the fantastic family fun zone as well, so bring your kids. Any other partner updates? If you don't want to share with, if you don't want to unmute yourself or stand up and hear and share, you can just email those to us as well, and we're happy to include any partner updates, any events in our monthly newsletter that goes out at the beginning of each month, or in our sector-specific newsletters that go out at various times throughout the month. So we're happy to share information with all of our partners. Okay, that's it. Thank you for joining us all today. We really appreciate it. We would appreciate if you completed the evaluation. We do listen to what you say in terms of what types of speakers to bring in, what kind of food to offer. So please fill that out. Our next meeting will be in June. We do not have a date set yet, but we will be scheduling that hopefully very soon so we can get that on your calendar. Thank you so much. Everybody have a great, beautiful spring day.